everyone.
Hi,
Welcome
everyone.
to Bear Care Corner. This is
Nicole. I'm the senior animal caregiver
My
here.
name is Andrea, the animal care manager. We're talking to you here from the main barn live with who's behind us?
We have Iona right behind us.
And we're focusing on keeping all the residents cool today because
Yes,
it is another
very hot.
super hot day. We're having one of those kind of typical end of August heat waves.
Classic.
It's challenging. Today we have a very special episode.
Very exciting.
I love doing these. They make me really happy.
Yes, we're excited.
It is the very special dental episode today, so stay tuned. We're going to talk about anything teeth related and all of our toothed and untoothed residents.
Yes.
Let us know where you're tuning in from. I see Daniel.
Hi,
welcome,
Daniel.
Welcome. Thank you for verifying that we're actually live.
Yes, and not muted.
And not muted. If you have any questions, let us know. We might answer them live if we see them. Sometimes the questions get going really quickly, but we'll do our best. We're going to start off with a quick thank you to our wish list donors from this week. So we had a few things come in from our Amazon wish list. One of them was a little kit, which include a new kettle. As
Incredible.
Nicole knows, our kettle's on its last legs.
Yes, it's been through some things.
It's seen a lot. It's been with us for many years,
Yep.
but it's struggling.
Yes.
So we were sent a new kettle and a bunch of packs of Fig Newtons with a very special message. I love when they come with messages.
Yeah.
This one was from Robin. Fig Newtons for the residents and staff. And now you can make tea. Enjoy.
Aw, thank you, Robin.
Super cute. And this next one was from Michelle for my
Nice.
sweet pig friends. I think those are 2 heart emojis.
Oh.
Super cute. These glucosamine pills are going to be in the breakfast and dinner meals of Hercules, Mercy, April, Brindle, and Tim.
Yes.
And probably eventually all of the
Everyone
pigs.
else, yeah.
But the older pigs really benefit from glucosamine.
Yes.
So welcome. Again, we are in our dental episode. We have been
Very
planning this
special.
one for a while.
Yes,
We first
we're
talked about
excited.
it maybe 2 months ago. We get really excited about healthcare in general, but teeth
Teeth in
are
particular, yeah.
fascinating. BJ is here to introduce you to the episode
Very
with his perfect set of front teeth. There is so much that goes on with teeth. We could probably
Yes.
stand here for an hour and talk about teeth, but
Easily.
we're going to get into it. There are some kind of gross tooth pictures, so if you don't want to see that, maybe this isn't the episode for you, but also Bear Care Corner tends to have some gross photos sometimes, depending on the day.
Yes.
So first topic of discussion is pig tusks. This is a huge one. This is something
Yes.
we talk about
all the time.
almost every day. So I'm looking at a picture of Hercules. Those are some long tusks.
yeah.
So you can kind of see, I'm going to show you Sammy next too. You can see those bottom. So Herky, his
He's a
are
special
long.
case, yeah.
His are long in this photo, but they're blunt.
Yes.
So lengthwise, you can see they also have a top tusk, and the males grow very quickly. Female pigs typically don't need tusk trimming, but what happens when they're chewing, when they're moving their mouths, the bottom tusks sharpen along the, I don't know how to,
Yeah, you know,
trying to,
there might be a good photo in here, maybe that shows
to
how it
demonstrate.
how
Yeah, we
it
have a
how
few
it
more.
sharpens. Yeah,
so they do sharpen. If they have a bit of an overbite or a bit of an underbite, that will change.
Yeah.
If the tusks get sharp, the most dangerous combination is a sharp, long bottom
Yes.
tusks. Not to say this wouldn't be a little bit painful if he
Right.
had bit somebody. His tusks are currently trimmed. All tusks are currently trimmed except Tim. He's the final one
Yeah.
on our list. We're making sure everybody's trimmed up before the move, so if there is any kind of squabbling at any point, any changes in the hierarchy, anything going on, reducing injuries. 'Cause
Yes,
these can cause
keep
a lot
everyone
of
safe.
damage. They can be very unsafe. I'm going to show you this picture, which is very obvious.
Yeah.
Little
Wow.
yawn from Sammy. What is happening here?
Oh goodness, those are some tusks that need trimming. Yeah, that's a really, really great photo where you can see really how sharp they get. It's pretty scary.
Yeah, and Sammy's tends to get sharp, and he's very high up in the
Yes,
hierarchy.
yes.
So the process of the trimming is very exciting for everybody involved. The whole thing takes only a few minutes.
Yes, very quick.
And we use a surgical wire wrapped around the back of the tusk. Do this really fast,
Yes.
and it cuts through. Tusks are not like normal teeth, and they don't have nerve endings. They don't have, and we make sure we're cutting just above the gum line. We're very cognizant of where the gum line is. But yeah, we're not cutting their teeth. We're cutting their tusks.
Yes.
Another example. I don't know who this is.
I I think that
Is that Brad?
I think that this is Ray, actually. So this is, I'm pretty sure, Ray from a couple weeks ago when he broke that top tusk. And the next picture might be after we trimmed his tusk. Oh, no, maybe not.
Different.
Okay.
This is to show that bottom tusk
Right,
kind of
yeah.
growing. This is somebody with an either overbite or underbite. I can't tell from this photo.
Yeah.
And the way their tusk is, the bottom tusk is kind of growing up into their top tusk, which is a bit of a weird angle.
Yeah.
They don't all, we have underbites, we have overbites. They have
Just
a variety
unique anatomy,
too.
yeah.
But yeah, I think that's a broken top tusk,
Yes.
which can also happen. It happened this week
Yeah.
with, is that Brindle's? Is that Brindle's or Ray? Because we've had that twice.
That
in the last
one I
few
think
weeks.
is Ray's. Yeah.
With a clip for scale.
Yeah.
So yeah, I think he got his top stuck in a fence when he was having a bit of a squabble with Ted pre-integration, and that broke off. It didn't break off below the gum line, so it's not too serious.
Yeah,
You
like
can
the
see
pulp
it's a
wasn't
bit-
exposed.
Yeah, exactly.
Yeah.
It's a bit jagged, so as that top tusk grows out, we're just going to be really cognizant of that it's not causing irritation on the top lip. And then Brindle's fell out a few days ago. He was at dinner. It must have been loose, or it must have been kind of banged on something previous to that, because they don't typically just fall out. And they are breaks that didn't fall out again with the pulp exposed, like you explained. And then last week we were extremely busy pre-integration for Iona and Penelope. So behind us, Iona on her own in her own stall rest, and then Penelope next door to her, which I'm kind of in the way of, but you can't see her from here. To get them back safely with their herd mates, we needed all of those males done, trimmed, and we did them all in one day, because why not?
Wild. There's so many.
So you can see the variety
of
there,
sizes, shapes,
Some of them are thick, some of them are thin. I see Sammy's.
Yeah, very, very clearly.
Some of them are kind of blunt, but we still want to make sure that those bottom tusks in particular are not sharp, because those can be really dangerous and cause a lot of damage to each other if they do get into fighting. Yes.
This is the after photo. So this is Ray's.
That's Ray.
So that first photo was Ray's. Yes, exactly. So this was just a photo of that top broken tusk. But it just so happened that like a couple days later, after we trimmed his bottom tusk, so it's kind of a cool, you can see the difference.
Awesome.
Of the way that bottom one was sharpening against that top tusk. And then a little bit later, once it was trimmed, so you can see the difference there. Yeah.
Of course, these photos always have like a lot of food.
Yeah.
And if you're just tuning in now, you're like, what am I looking at? This is a pig mouth.
It is teeth.
And teeth. And pig teeth are hilarious. We're going to show you a few more pictures of them. Same. That's somebody else with a broken top tusk.
I think that's Ray's the same broken one yesterday.
Okay. So we do love documenting.
We do, yes.
Everything constantly, because that's pretty low risk of anything happening to it in terms of like infection or whatnot, but not completely unlikely. So we're checking them every 3 days, I think, right now.
Yes.
And then pig teeth in general are just so fun.
Yeah, those incisors, hilarious.
So this is just the top. It's a Fiona, adorable.
Yeah, we love them.
I did include the one that you took of Ray recently, but like the bottoms are just so special. You'll probably see that picture eventually. And then also, so they have those incisors, and then further back, they got their molars. And we have found molars out in pasture before. I don't think we ever figured out who this was.
No.
So that can happen. Again, we're really cognizant. If it was to lead to anything like an abscess or pain or issues, we would know, because they wouldn't be eating.
Yeah, facial swelling, blood.
Temperature, if there's an infection, not wanting to eat or hesitant to eat. So we never really figured out who that was.
No, and that was what, 2023? Yeah. Wow. A year, 29th, a year ago tomorrow. Oh, that's
Happy anniversary.
That's really special.
Wow.
That's cute.
Time flies around here.
Yep.
Next topic is goat and sheep teeth, which is a whole other situation.
Yeah, completely different. We deal with quite the range of like different dental anatomy and different styles of teeth and how they grow. So ruminants, much different from pigs.
Teeth have a lot of different things going on. So you saw the test, the complicated situation with pig teeth or incisors, the little molars. This is Abraham demonstrating kind of the palate, the top palate.
Yes.
A lot of people are shocked to know this.
Yeah.
But there are no top teeth at the front.
Yeah.
They have molars top and bottom at the back, but the bottom teeth are there, and it's a hard palate at the top, so that's what they use to grab grass. And that's what they're eating like 99% of the time, or hay. But to grab grass, you don't really need 2 sets of teeth. So this is him demonstrating a few nights ago. He's also doing something called the Fleming response. So he had smelt some hormones and some urine that he was sniffing. That's a whole different episode.
Yep.
Stay tuned for Halloween episode. Nicole had grabbed this for us. This is kind of the setup of goat and sheep teeth, goat teeth. I guess sheep are pretty much the same.
Yeah. I think maybe the numbers might be slightly different, but overall the anatomy very similar. Yeah,
and look at the aging too. We're going to get into, I have some pictures of when, I think it was Pixie or Hazel in a second.
Yeah.
So we're going to compare them. How different they look as they age.
Yeah, like you can kind of see the left side of that image. Basically, those bigger teeth are the adult teeth coming in and replacing.
And they lose the little teeth.
Yes, exactly. Yeah, and then as they get older, which we'll definitely see photos of it, their teeth get spaced further and further apart, which is extremely cute. So yeah, they can help us, especially when we have resident intakes and we don't have an age of, like, we don't actually know how old they are. So teeth are one of the things that we can use to help kind of guesstimate an age for a ruminant.
That's one of the main ones, and also sometimes horn growth.
Horns,
but people have different rates of horn growth, so it can be trickier. But yeah, teeth is a big one. Here are some upper molars that had fallen out from Doug a few years back.
Yeah, this one, I think that's the one that he had floated on site because it was that hard. It's hard to tell in this picture because it's kind of a rotten tooth to begin with. Because I think Doug at this point was already 13 or 14, so it was a little remnant that he had of that molar, and there was a sharp edge to it. So it was causing him some difficulty eating. So we had him slightly sedated on site, and that sharp tooth was removed. Yeah.
The main thing with the molars, we're going to get into a little bit of teeth floating with pictures of Escalade as well. But with the molars with ruminants, they need to be not flat. But if you see them chewing,
it makes sense
right now, like they chew side to side to really grind down the grass, hay. It takes a lot of work to break down the cellulose, to break down all the nutrition. So if there's one like molar, one of them's like spike, you call it a molar spike, then they can't really do that motion as well. So we do teeth floating. We do examine the teeth, like here with the speculum, a way to keep their mouth open so you can see back, because their molars are way back there. You can't just open the mouth and
just take a look. Yeah.
It's really hard. The tongue's in there.
And it can be very dangerous for us as well, especially if they have those sharp molar spikes. It can be quite dangerous just sticking your hand in blindly as well. So the speculum is really, that's what that device is called, the oral speculum. So very helpful. Yeah, it was very,
very good. You get a flashlight in there, you can see a bit better. And that saves a sedation potentially.
Yes, exactly.
If we're able to visualize without having to. We can also do RADS imaging on site. Here's an example of baby teeth that we were just talking about. This is Nicole. We do reference photos as well. So that kind of, if we go back here for a sec, and you know that she's just over a year old, you can kind of see, if we go back and forth, those teeth matching up. Yeah,
so those two central incisors, so it looks like those ones are her adult teeth.
Yes. Super
That's
cute.
Very cute.
So we can see that we love documenting things.
Yes.
And then on the opposite end of the spectrum, I don't remember who this was, but bottom teeth really worn down over time with age.
Huge spacing between them.
And those are, when we see something like that, when we know something like that is happening, then we're doing supplemental feeding, and we're doing things to make sure they're getting the calories they need, because those aren't a lot of teeth.
Yeah, not helpful for eating.
No, and keeping an eye if they're falling out. Typically, falling out when an older age doesn't really cause too many health issues.
Right. They're already ready to go at that point.
Just boop. Kind of like they lose their baby teeth.
Yeah.
Another thing that we're keeping an eye on is something called dropping cud. What is that?
This is a great picture. Yeah, so basically,
it's a good picture.
Enrique. So ruminants, they chew their cud. So basically, they have a completely different digestive system from like monogastrics like us and the pigs. So part of how they help themselves like process all of that cellulose and grass that they're eating is they do the first chew, swallow it, then basically it comes back up and they keep chewing. So they're chewing that cud many hours a day, and part of what we look out for with dental issues is dropped cud. So there's a really great picture coming up of, yes, exactly, so dropped cud there.
The dropped cud.
Yeah. So that's just finely chopped, but not finely enough, bits of hay, straw, their meals. So ideally, we wouldn't want to be seeing that on the ground. So if they're dropping
it's a very particular shape.
Yeah.
When you go up and you're looking around like that's dropped cud.
Yes.
Or you might see it happen. One time I went up and there was dropped cud on the ground, and I was like, oh, I wonder who that is.
Yeah.
And I watched the overnight cameras, and Obama was chewing his cud, so they bring it up, like Nicole had mentioned, re-chew.
Yes.
But as he was chewing, it just fell out of his mouth. So that indicated some dental issues. And it has a very particular, it's like a little patty of...
Yeah, exactly. Like you look at that and you're like, oh, this is that. Like you can't mistake it for anything else.
Yes.
Yeah, exactly.
Yeah, it's a very specific look to it. So we're always looking for drop cud. That can happen with older, especially goats and sheep. And it can happen if there's dental issues, jaw issues, kind of anything else going on like that. Or they're not wanting to swallow if there's even GI issues, gastric issues. Speaking of Obama, we have a lot of photos of him.
We could do a whole episode on his bottom teeth.
If you've been with us for a while following the sanctuary, you would know his kind of journey of his teeth.
Journey.
He is an older man, and now he has only a few molars left.
Yeah,
at one
4
point.
maybe? Was that the last count?
Yeah, we do have the rads coming up. If anybody can read them, there's about 4 molars in there. So this was us kind of, you can see they're not, they're kind of thinning out.
Yeah.
And at that point, we took this picture to document because they were starting to get loose too. So we'd also, this was a video, I'm not going to show it, but the wiggly teeth.
Oh, yeah.
You remember that?
Oh.
And now looking back at photos when he had those bottoms,
he looks completely
like he has
different.
Dentures.
Yeah.
We actually haven't looked at these in a minute.
Yeah.
He doesn't look like, I'm going to show you the photo of how he looks now, but it looks like somebody put dentures in his mouth. It doesn't look real.
Yeah, completely different.
And
that's a great one. They look like little chiclets.
Yeah, perfect little teeth over time. And then eventually they started following out, which we were constantly checking if he was having any gum irritation or any infection, which didn't happen, but we were always looking at his mouth and documenting. That's when he had 2 left. And then eventually we went to the famous, and I think he hung on to this for about a month, not a month, a year.
Yeah, a long time. It was very shocking.
And the single tooth right in the middle was just always greeting us in the mornings.
Yeah, absolutely iconic.
We're always just so happy to see that little tooth. It wasn't doing anything.
Oh, absolutely
not. At this point,
not.
he'd been on supplemental feeding. He was all set with all of his stuff, so it wasn't doing anything. It wasn't picking grass for him.
It was just a matter of time before it
fell out.
Oh my god!
This is not a snowflake. This is his tooth.
Oh,
and then the
really
final after photo, looking in his mouth. There's nothing. And if you didn't know what you're looking at, this is also his mouth.
Yeah.
Bottom gums. No teeth. We recently, in the past few months, did some imaging on site just to confirm that he actually had some molars left to determine do we need to add more supplemental feeding. The supplemental feeding, what's in it?
So right now it's beet pulp, hay cubes, and a little bit of grain.
Yes, and the hay cubes are essentially it's already
finely chopped. Yeah, exactly.
And then re-soaked. So it's essentially like the cud that you saw.
Yeah, that's true.
It's like pre-chewed.
Exactly. So it does a lot of the work for him.
Yeah,
basically.
and I'm going to show you a picture of that in a sec. So Rad's super cute. He was a very good boy. So that you can see the plate on the one side, they shot from the other side. He has the spacer in his mouth to get those images. And here is the final result. That round piece is just the little thing in his mouth. And they think he had about 4 molars left. And this was probably 2 months ago.
Pretty recently.
So he's still working away at those molars, but we do every single day, twice a day, and he looks forward to it. He has his old routine. If you want to see part of his routine, watch my last Bear Care Corner video, because the morning he comes down to the barn, there's no other way to feed him.
Absolutely
not. It's out of our hands.
Yeah, we can't control him.
No, he comes out, he eats. He tells us when he wants to go back in.
He tells us if he wants more.
If his routine is off, it's just
and it's an important part of the day for us as well. Like I really look forward to it, like releasing him in the morning.
So this is him every morning and every night essentially.
Yeah, very passionate.
Big bowl of that mash that we mentioned. The beet pulp is something that's a bit higher calorie, and then the hay cubes. These guys, the ruminant, should be eating like 99% hay, that kind of stuff, grass. So that's in there as well. Sometimes we put a little. He also gets a fig Newton with his gastroprotectant, and then he also gets a few extra fig Newtons.
Look at him.
Yeah, he's pretty cute. So yeah, no teeth left. Super cute.
But yeah, still doing really, really well.
He's doing amazing. Yeah. We're able to maintain his weight. His weight's been the same for ages.
Years.
Which is great. Yeah. We've been able to maintain his weight despite the fact that he has pretty much no teeth left. Yeah. We just gotta look at this one more time before we're in the next pot pick. This is like, I forgot this photo existed.
Oh my gosh.
He is.
What a guy.
Just wonderful.
Yeah.
Like, there's so much what we just love about him.
Yeah, he's very special.
He's just a presence here.
Yeah,
That's a whole other episode again.
Yeah.
So we should do an Obama episode.
Agreed.
Okay, so we're going on to teeth floating. This applies to goats and sheep, ruminants, but also
horses.
So we have a few photos of Escalade getting his teeth floated. That's a very weird word. People are like, what do you mean you're floating his teeth? You take them all out and you put them in water and they float. No, it's the process of what is happening.
So basically, it's grinding down those sharp points. So in this photo, basically Escalade has a big oral speculum in his mouth. So similar like the one that we use for the goats and sheep. It holds his mouth open, and then it allows the vet to visualize inside of his mouth, be able to access all of those teeth as well. So with horses, kind of similar to ruminants, they do have top and bottom incisors, but also lots of molars and premolars. So with kind of similar chewing, you want to make sure that those are grinding down easily. Yeah, horse teeth are pretty wild. So like ruminants, they can get sharp edges where the edges of the molars will actually poke into the cheek, and obviously uncomfortable, painful, and kind of just part of routine healthcare for equines as well. Yeah. So yeah, there's Escalade being a very brave boy, having his teeth floated, just scared of those sharp edges.
A big part of his braveness in this photo is sedation.
Yes.
So he is actually sedated. They can do a standing sedation in horses where it's just enough to make him not worry about what's going on here. I feel like I need that at the dentist.
For sure.
But also still standing. I forgot to include this photo, but we had cleaned up after we were done this procedure. We didn't want him waking up and eating all like the hay and stuff around him. So we cleaned the stall, but where he was standing, under each foot was just like a pile of hay because he didn't move.
Oh,
it was really cute. So he's partially sedated for that. And how often is that?
Off the top of my head, I don't know when but usually like once a year. Yeah.
Once a year, at least a check.
Yeah.
I think they're coming due soon.
Yeah.
To check our calendars. We have a lot of things in our calendars.
There's a lot happening.
We just finished yearly vaccinations, but there's recurring monthly. There's recurring daily things. There's recurring monthly, weekly, yearly, all that kind of stuff. Last thing, small animal dental care.
Oh wow.
So we do have Enrique. They're just showing off their beautiful, absolutely gorgeous teeth.
Very nice.
What goes on with small animals? We got the cats and then Cooper the rabbit. What kind of issues or what kind of things are we dealing with small animal dental care?
So for Cooper, we are constantly checking that his top and bottom molars, the big teeth, because those are the two big buck teeth on the top and bottom. Yeah, exactly. Iconic rabbit teeth. Those ones are being worn down properly.
They constantly grow. Right?
Yes, exactly.
So they need to be chewing on stuff.
Yeah, hay,
to keep
Timothy
them
hay,
down.
constantly.
Yeah.
And he hasn't had many issues with those. But rabbits also do have molars and premolars further back that you can't see.
Yes.
Same thing with without sedation or a speculum. So Cooper, as far as I can remember, I don't think he's ever had any dental issues where we've had to do like a sedated or a file down.
So,
But Terry, Terry, I'm pretty sure we have had to do that with him in the past, that his molars have become overgrown. And same thing with, or similar with the horses and the ruminants. Basically, it's those sharp edges pointing into the insides of the cheeks, which is not fun for anyone.
So how do you know if they're having those issues?
Yeah.
How do you prevent them?
Definitely the number one big thing is making sure that they always have access to Timothy hay and things to chew on, and kind of like around, like, consistently for like most of our species, things like, you know, facial swelling, inappetence, reluctance to eat. So part of why we are extremely like alert when we're feeding all of the residents, because yes, it's as simple as giving Cooper or the pigs their breakfast, but also making sure that we're actually assessing them, that they're eating properly and behavior and everything else is normal as well. So a lot to keep an eye out for.
And health checks.
Yes.
And health checks, one of the things, I mean, pretty much every body part is on the health check sheet, but one of them is jaw. And jaw tells us a lot. They can be those molar spikes, they can be abscess in the jaw, any kind of things like that. And we've had lots of things like that. Not always dental related, but
and that's actually a good one too, because that's part of how we've been able to tell when some goats and sheep have had molar spikes, because you can actually, not all the time, but sometimes you can actually feel it from the outsides of their cheeks.
Yes, not all
so
the time,
that's a good one.
Yeah, when you do this, you're like, oh.
Or they'll be a bit sensitive, and you can tell.
Or changing their eating habits. So that is our dental episode. I hope everybody enjoyed it.
We love teeth.
Yes, we're obsessed with teeth. We're always thinking about them. We're always talking about them. We're always documenting them, along with everything else that goes along here. Thank you so much for tuning in today.
Yes, thank you so much, everyone.
To see everyone. We'll see you again next time.
Thank you so much. Bye everyone.